Have you ever wondered what you would do if someone you cared about needed cardiopulmonary resuscitation? Seconds matter. I've seen how fast a normal day can turn upside down very quickly. When the heart stops, the brain starts running out of oxygen. After 2 to 3 minutes, brain cells begin to die, and the chances of survival drop off dramatically with every minute that passes. Delayed CPR can mean permanent brain injury, long hospital stays, or not making it at all. The good news? Hard and fast chest compressions can double or even triple someone's chance of survival. Hi, I'm Tony Coffey, and I see how quick action makes a real difference. I have been delivering and teaching first aid for over 30 years and also been a registered paramedic with a major Australian ambulance service. In this video, I'm going to share with you the top 5 things you need to know so you can act with confidence in those first critical moments. Stick with me to the end, and I'll share with you common misconceptions people have about CPR, what it does, and how it works. Also about an automated external defibrillator, or an AED, which delivers an electric shock to the heart. 5 very important things to remember for a cardiac arrest. Firstly, number 1, recognize cardiac arrest is not a heart attack. Cardiac arrest is an electrical problem in the heart during which the heart muscle is unable to pump blood. A heart attack is a blockage in a blood vessel in the heart, resulting in damage to the heart muscle. A heart attack can lead to a cardiac arrest due to the muscle being damaged. Sudden cardiac arrest can occur with no prior signs or symptoms at all and accounts for up to 20% of deaths worldwide. It can happen at any age, but the likelihood increases with age. Signs and symptoms: the person will suddenly collapse and not respond to you calling them or inflicting pain on them. Often there will be seizures or movement, but nothing intentional, and either no breathing at all or abnormal breathing attempts. Their skin may turn pale, grey, or blue, especially around the lips and the nail beds. What's happening inside the body is this: the heart has stopped pumping blood efficiently. Either it's completely stopped or it's just quivering without pumping blood, known as ventricular fibrillation. Without blood flow, oxygen can't reach the brain and vital organs, and the blood pressure in the arteries will drop to near zero. If you miss this, every minute without CPR and defibrillation lowers the survival rate significantly. Brain injury can start within 2 to 3 minutes and becomes more severe the longer you wait. What to do now? Start CPR immediately. Push hard and fast in the center of the chest. By recognizing the arrest and commencing CPR, you can buy time by pushing blood to the brain to delay the brain damage until the help arrives. Number 2, differentiate between normal and abnormal breathing. A person who is not in cardiac arrest will have regular, quiet breathing with steady rise and fall of the chest, and they should respond or move when you speak to them or touch them. Their breathing may be fast or it may be slow, but it has a regular rhythm to it. Abnormal breathing can be easier to find because it sounds very different. They could be gasping, like a fish out of water, snorting, or gurgling, or occasionally noisy breaths with long pauses, or have slow, barely there breathing at all, and little or no chest rise. What's happening inside the body is the brain is triggering the reflex gasps, even though the heart isn't pumping. Air may be moving, but oxygen isn't getting to the cells. If you misjudge this and assume that they are breathing because there is air moving, you lose precious time and the brain damage starts. We need to act quickly. Start chest compressions and send somebody for an AED and call emergency services. Number 3, what a person in cardiac arrest looks like. External clues that you may see and feel include their eyes may be open and fixed, or just half open. Their body may be limp or have brief jerking movements. Skin may look grey or blue and feel cool and wet. Inside the body, what's happening is the heart's electrical system is chaotic. Blood flow stops, carbon dioxide builds up and the brain is starved of oxygen. If you hesitate, the window of opportunity for them to be able to receive an electric charge to shock them back to normal closes quickly. Start compressions immediately to keep blood pressure up and keep some blood moving to the brain and the heart, improving the chances that a shock will work when the AED arrives. CPR needs to commence immediately, starting with the compressions. Place the heel of your hand in the center of the chest on the breastbone. The other hand on top of that. Lock your elbows straight with your shoulders directly over your hands. Push hard and fast. 100 to 120 compressions every minute, about 1/3 of the chest depth. Let the chest come all the way back up after each push before pushing down again. The body will use up what oxygen was already in the blood within a few minutes, so it needs to be replaced by blowing air into them. We cannot stop the compressions for more than 2 seconds at a time, however, because the blood pressure will fall away sharply again, and it takes more time and more compressions to bring it back up and to push oxygen back to the brain. To do this, stop, tilt the head back as far as it will go so the airway will be open, and blow a normal breath into their mouth or into their nose if you prefer, until the chest begins to rise. When it falls, give another breath, then back to the compressions. We need to repeat this after every 30 compressions. What's happening inside the body is each compression acts like a manual pump, creating pressure to move blood to the brain and the coronary arteries. If you delay or don't compress deep enough, not enough blood reaches the brain, and the chances of a successful recovery drop. What if the heart was still beating and you started compressions because you were not sure? A conscious person will let you know by resisting or pushing you away. Brief compressions on a heart that is still beating are unlikely to cause serious harm, compared with the risk of not starting at all in a real cardiac arrest. If they're responsive and breathing normally, stop compressions, put them on their side, and monitor them. We do need to act quickly. Strong, steady compressions can double or even triple the survival rate until defibrillation and advanced care becomes available. Number 5, call the AED and teamwork. Call for help immediately or get someone else if you're doing CPR and say possible cardiac arrest. Give the address and don't hang up. If an AED is available, send someone to get it. Turn it on and do what it tells you to do. It will tell you to place the pads on the patient's bare chest, as shown on the diagram on each pad. The device will then analyze the heart rhythm and will advise if a shock is needed, and only if a shock is needed. What's happening inside is the device is only looking for an electrical rhythm that it can shock back to a normal rhythm. If it cannot find one, it will ask you to do CPR. If it does find one, it will send a shock or ask you to push a button to deliver the shock to stop the heart, and hopefully it will revert to a normal rhythm. As soon as the shock is delivered, resume compressions immediately. Don't wait for the device to tell you, it's going to say that anyway. We need to keep the blood pressure up. If you skip the AED or wait too long, the rhythm can deteriorate to one where the shocks do not help. We need to act quickly. Good compressions plus early defibrillation is a winning combination. Earlier in this video, I said I will share with you common misconceptions that people have about CPR with questions I'm often asked. Firstly, CPR is nothing like you see depicted in movies. The person usually does not get up and walk away. Number 1, CPR does not fix a cardiac arrest. The person is very sick. What we're trying to do is keep blood pressure up and push oxygen to the brain to prevent brain damage until medical help is available. Number 2, but when we breathe into the person, we're giving them carbon dioxide. How does that help? Yes, the air we exhale does contain a lot of carbon dioxide, but it still contains about 16% oxygen. The red blood cells in the body will only attract oxygen molecules, nothing else. It is not a lot of oxygen, but it is enough to keep the vital organs going. Number 3, does a defibrillator shock someone back to life like it does in the movies? Sadly, no. The defibrillator does not start the heart. It stops the heart. It stops it from fibrillating, which is a fancy medical word that means unsynchronized twitching. The defibrillator tries to reboot the heart, if you will. What if I accidentally shock someone? Will it harm them? The AED is making the decisions, not you, and it is based on the rhythm it detects. It is only looking for a shockable rhythm, and it will not make a mistake. What about if somebody is touching the person when the shock is delivered? Will they be electrocuted? No. It is a very small charge, about 150 joules, which is traveling through the heart between the two pads. When the shock is delivered, you may feel some movement if your knees are touching the patient, but not an electrical current. Nothing to be afraid of. So a quick recap. If the person is not responding and not breathing normally, begin CPR with 30 compressions, hard and fast, about 2 times per second, followed by 2 breaths, and repeat until the person begins breathing normally or professional help arrives. Call for help and attach an AED pads to the person's bare chest and do what the machine tells you to do. You don't need to be perfect. You need to be there for the victim. As a paramedic, I'd rather arrive to see good CPR than to arrive and find silence. You can do this. What I would suggest, though, is taking a CPR class where you can practice on lifelike mannequins. Also, locate the nearest AED to where you work and live and share this video with the people who watch your kids or your parents. The life saved could be a member of your own family. Thanks for your time. If you found this useful, hit the like button to help other mums and carers see it. If you have any questions or any other topics that you would like me to cover, pop them in the comments section and I can make that happen for you. Down below, you can also find useful links, such as a printable CPR chart. If you're in Vietnam and you would like to co-host an event with me presenting, check my website link below and also check Survival Skills Vietnam website for a whole range of online and face-to-face first aid courses that you can enjoy. Stay safe and care for each other.